February. Then the application period closed on March 13th. Those have gone through the electronic scoring, and they're now in the process of going through the virtual peer panel review as we speak. Now, could you mute your phone, please? Mute your phone. The virtual peer panel, we previously used to bring people together to do the peer panel review, 150, 200 firefighting people together to do peer panel review. Obviously, we can't do that now, so they've devised a system where we're doing peer panel review virtually. We have people doing it from their station or from their home, and it seems to be working out pretty well. Right now, they've gone through, they've completed the state fire academies, the non-affiliated EMS agencies, the volunteers, and I believe they're working on the combination departments now and be turning to the career departments very shortly. That process should be completed in the next 1 or 2 weeks. Then we will begin the post-panel technical review process, and that will run into May, into June. We are actually hoping to start the AFG awards in June, July, and August. June, July, August. All awards must be made by September 30th, which is the end of the federal fiscal year. So this will be a busy summer for us. And last thing, Lance and I do not yet have access to any scoring. We do not have the ability right now to look and see what your score was. If you went to peer review, did not go to peer review. We don't have that access in the FEMA Go system. At some point we might, but right now we don't. So if you're curious about how you did, we can't help you quite yet. 2019 SAFER. The 2019 SAFER application period is open right now, and it's open through May 15th, 2020, which is 2 weeks from tomorrow. The NOFO is available at our website, FEMA.gov/fire grants. We're expecting to do the post-panel technical review on SAFER applications in late June, and we're planning on SAFER awards starting in the July, August, September timeframe. Again, all awards need to be made by September 30th of 2020. If you're having a question or a problem about your SAFER application, give Lance or myself a quick call. 2019 Fire Prevention and Safety Grant updates. That application period is now open. It opened this Monday, April 27th, and it's open through May 29th of 2020. That NOFO is also available at our website, FEMA.gov/fire grants. We probably will be doing the post-panel technical review on fire prevention grants at the same time that we do SAFER in late June. And again, all the fire prevention awards should be coming out July, August, September. All awards must be made by September 30th. Again, if you have a problem or a question with a SAFER or a fire prevention grant, give us a call. Right now, we have 3 grant programs that are open: SAFER, fire prevention, and the AFG supplemental grant program. All 3 grant programs are open at the same time in the FEMA Go system. Any questions at this point about 2018, 2019, or closeouts? Any questions at this point?
Yeah, Chief.
Go ahead, sir.
Jim O'Neill, sorry to jump in. I just came out of the doctor's office. I jumped in late. What about the supplemental grant? Anything? I missed that piece of it. I apologize.
No, we haven't got to it yet, Jim. We're waiting just for you.
Oh, I thought you were. Okay, thanks. Sorry.
Okay. The AFG Supplemental Grant Program. The application period opened yesterday, Tuesday, April 28th, and it's open only until Friday, May 15th at 5 p.m. Eastern Time. It's open for almost 3 weeks. It's open for another 2 weeks. From 2 weeks from tomorrow, it will close. Okay? The NOFO is available at our website, FEMA.gov/fire grants, and you can download the NOFO right off this presentation over in the file share section on the left-hand side of the screen. Click on it, click on download. It should download for you, the NOFO for the new AFG Supplemental Grant Program. Perfect. Let's talk about the Supplemental Grant Program. What is it? Basically, it's a supplemental to the AFG program. It's $100 million that was approved as part of the COVID-19 CARES Act package that was passed recently by Congress. That $1 trillion or multi-trillion-dollar package included $100 million for AFG. This is a separate new grant application in FEMA Go. It was not associated with the 2019 AFG or the 2020 regular AFG that might be coming later this year. A separate, distinct grant program. Fire departments and fire districts, non-affiliated EMS agencies, and state fire training academies are eligible to apply for the AFG-S grant program. Regional applications are also available as well. And we do have a micro grant option for you within the AFG-S grant program. It's limited to $3,000. As you may know, on a regular AFG application, we have micro grant option, which limits you to $50,000. On this particular grant application, you're limited to $3,000 to submit as a micro grant. So if your request is $3,000 or less, you could and should consider putting it in as a micro grant. Basically, what we're using is the typical edited AFG application for this AFG-S grant program. They've gone in, they've taken some things out, like seated riding positions and maybe a couple other things, but it still has pretty much all the sections of the application: budget, call volume, applicant characteristics that you expect on a regular AFG program. Now, this is on a fast time frame. They want to get this money out on the street as soon as possible. They're planning to close the applications on May 15th, immediately go into the scoring, and they're actually hoping to have these awards to be made in June of 2020. So it's a big, fast turnaround here to get this money out in the street to you folks. Excuse me. I will say to you at this point, I just want to put this in there right now. Right now, this is the only supplement to the AFG program that's active. Is this $100 million program. There is a lot of talk. I know the IAFC, the International Association of Fire Chiefs, is actively asking Congress to, if they do pass another bailout or supplemental budget for the CARES or for the COVID program, they're asking that $5 billion be added to AFG and $5 billion be added to SAFER. That has not happened yet, and we don't know if it will happen. That's yet to be seen. But right now, there is no supplement to AFG or SAFER other than the $100 million we're going to talk about right now. Okay, in the AFG-S grant program, there's only 7 items that are eligible for you to apply for. It's a limited EMS PPE grant items that are eligible for you to apply for. It includes eye protection, isolation gowns, protective coveralls, gloves, footwear covers, respirators, an IOSH-approved respirator, and surgical-type face masks. Those are the only items that are eligible to be applied for in the AFG supplemental grant program. Also, you could apply under the category of supplies for either for decontamination or disinfection supplies and services, or for PPE, station quarters, and vehicles. You could apply for replacement high-efficiency particulate air filters for your respirators, and personally issued antiseptic hand washes, hand rubs, and whatnot. These are the only items that are eligible for you to apply for under this particular grant program. Firefighting PPE, SCBA, PPE washers and dryers are not eligible for this grant program. I need to say that because there is a vendor out there that's sending out an advertisement saying that you can apply for PPE washers and dryers under the supplemental grant program, and that is not true. Okay, you're limited. You're very limited in what you can apply for in this grant program. Now, also, you can apply retroactively for any purchases made going back to January 1st of 2020 for reimbursement. You can apply for supplies, EMS PPE that you need right now for immediate use, or for what you might need in the future. And keep in mind that all the talk is that this virus is going to make a second wave in the fall, so this may be an opportunity for you to stock up on your EMS PPE. Applicants requesting reimbursement or requesting immediate use of PPE will receive a slightly higher consideration than applicants requesting funds to prepare for future response capabilities. Okay, so you do want to keep that in mind, but if you still have future use, I would apply for them anyways. Don't let that shy you away from applying for what you anticipate you might need for future use. And the third bullet is the CDC is providing timely updates on information regarding COVID-19. And I'm going to talk about this in just a minute, but you should definitely be looking up your statistics for your individual town or city as to how many cases, how many deaths you had. If you have any particular situations, like a nursing home that's had a large influx of cases and deaths, that information all should be gathered and used in your application, and I'll show you where in just a minute. Any questions at this point on the first part of the AFG supplement? I see my friend Lance is answering some questions here. That's appreciated. Any questions? So we'll keep moving. This AFG-S or AFG supplement application is located in the FEMA GO system. If you applied for a 2019 grant or even a 2019 SAFER or fire prevention, these grants are all now, applications are now located in the FEMA GO system. And you get to the FEMA GO system by go.fema.gov. You should be familiar with it by now. And please remember that the FEMA GO system is attached to your SAM.gov registration for your particular city, town, or agency. So you need to have an active SAM registration in order to have an active FEMA GO registration. If you have not applied or have a FEMA GO registration, you should give Lance or myself a call. But if you've already applied, you've already been through those steps and you're very familiar with FEMA GO, if in fact you applied for a 2019 AFG grant back in February and March. When you first go to go.fema.gov, you're going to come to this page where you put in your email and your password and log in. And once you log in, you're going to come to a page where on the left-hand side, it's going to list all it says My Grants. It's the grants that you either have received or have recently applied for. So these are grants that you have already received or are in the process of applying for. If you're looking for the new grants, they're over here on the right. The first one is the COVID supplemental grant program that we're talking about now. You would click on Start Application to start your AFG-S application. And here's your fire prevention application for this year and your SAFER application. Remember, once you start the grant, and if you log out, when you come back, you want to look for this application to be over here on the left-hand side under My Grants, and then you identify it and just click on Continue Application to keep working on it. You don't have to come in and start a new application every time you log in and log out. So keep that in mind. A lot of people ended up creating a lot of excess applications by making that little mistake, but it's not a big deal. We can take care of them later. So again, you find a new application on the right-hand side under Apply for a New Grant, Assistance to Firefighters Grant, COVID-19 Supplemental. Click on Start Application. That brings you into the application. When you get into When you get into the application, the first couple, you're going to have to fill out the first couple of sections: applicant information, applicant characteristics. You'll need to do your call volume. You'll need to do your budget information, and eventually you'll get down in the application to the request details section. And it's going to ask you to add an activity, and when you click on add an activity, you have two choices: either personal protective equipment or grant writer fee. Those are your only two options here under activities. You click on personal protective equipment. The next page is going to ask you which item are you requesting. And these are the 8 items: eye protection, footwear, gloves, gowns, coveralls, respirators, supplies. And supplies includes the disinfection, decontamination, and respirator filters, surgical type face masks. Those are the limit. That's what you can apply for under this grant program. Those 8 items. So you're going to pick whichever item that you want to apply for, and you need to keep in mind that you may have to, depending on what your list is or what your wish list is, you may have to make multiple entries, multiple line items. And I'll show you that in just a second. So you click on what you want to apply for, click on Confirm, and the next page is going to bring you to, for example, I clicked on gloves, and I wanted 1,000 gloves at $5 each for a total of $5,000. Now you need to go over here and select which budget class it is. And pretty much all this equipment under this grant program is going to be under supplies. Unless you're looking for a piece of equipment like a disinfection piece of equipment that you might use in your station or in your ambulances, that would be under equipment. But for generally, most of the items here would be under supplies. Then, once you do that, you're going to click on confirm. And the next question we're going to ask you is your request for a reimbursement for what you already purchased? Is it for immediate use of your PPE, or is it future response capabilities? So if you purchase gloves and you're seeking reimbursement of the gloves that you purchased in February, you would have to click on reimbursement. If you're also seeking gloves that you want for immediate use, you would have to put in a separate line item for the gloves, and then the amount, and click on immediate use. And then again, if you're looking for gloves or gowns or something for the future, you would click on future response capabilities. So yes, you could, depending on what you're looking for, what you need, you may end up with multiple line items here for various types of equipment or various supplies, and whether you're seeking reimbursement, immediate use, or future response. Once you do that, the next page or the next item, there are two questions that they ask you. One, are you requesting from members that currently do not have above-mentioned items? You want to click that yes. And is your department trained in the proper use of the PPE being requested? You really should answer both of those questions with a yes. Now, once you complete your line items, your activities, the multiple line items, if you're doing multiple supplies or multiple reimbursements or current immediate use, you will have to write the typical AFG narratives for your grant application. Keep in mind that if you did a 2019 AFG application, you could go back to that AFG application and grab the financial need, the critical infrastructure, and the community description narratives out of your 2019 application, and probably with very little tweaking, just copy and paste them into the new AFG-S application. But you will have to go in and write a project description, cost benefit, and statement of effect narrative, just like you do on AFG for your request. And they should be pretty easy. On the project description, you basically want to tell us what you need and why you need it. But we're stressing that here is where you want to put in your facts and figures about your municipality, the number of cases, the number of fatalities, any special circumstances. Do you run the EMS service for your department, for your community? So give us all the particulars there, and make sure you put in the facts and figures, and the facts and figures about your caseload and depth, but also about your needs with respect to what your projected needs are for EMS PPE moving forward. When you go to cost benefit, that's pretty simple. The cost benefit of this is you better protect your firefighters so they do not get sick. They do not go out on injury leave. They do not go home and contaminate their family. And I know a lot of departments have had firefighters and EMS people quarantined after exposure, and they're out of work for 2 weeks, and they have to be replaced by overtime and whatnot. So cost benefit should be pretty straightforward. Statement of effect should be pretty straightforward too. The purchase of this equipment is going to help you better protect your firefighters and keep them safe. So though you do have to do the three narratives for your requests and on the AFG-S. And at the end of your application, you will remember, if you've done a FEMA Go application before, you'll be on the review application. It's going to tell you if you completed all the different sections of the application, and if you have any sections that show in red, you'll have to go back and try to find the problem and resolve the problem. So you will not be able to submit this application until all of your check marks are in fact checked in green, and you're ready to submit. Okay, I'm going to take a quick break and ask Lance to jump in here and talk about which might be a little bit of a curveball that's being thrown at us on this grant program, which is the Public Assistance Program as part of the Major Disaster Declaration for all 6 New England states. Lance, do you want to jump in? Give me a breather.
Sure. Good afternoon, everybody. Before I start talking about this, I I want to say how thoroughly impressed I am with the last few slides and the quality of the screenshots Dave was able to pull off of the system. So I'm going to give a quick count to 3, and when I do, if everybody would unmute their phones and give a quick round of applause to Chief Parr for that effort, I'd really appreciate it. So how about a 1, 2, and a 3? Good job, Chief.
Yeah, I'm blushing. Thank you.
All right, thanks everybody for that. Any chance I can get to embarrass my compadre, I do. So, real quickly, one of the things you're going to run into as a result of the fact that this AFG supplemental grant is being born out of a disaster, the fact that it's being born out of a disaster, and every one of our states in New England has received a major disaster declaration, which includes the public assistance program. So one of the things that you're going to have to be careful with, especially those of you that are considering doing a reimbursement of PPE that you've already purchased, is making sure that those purchases weren't already accounted for under the public assistance program. One of the things to keep in mind is the public assistance program reimburses at 75%, so you're going to be on the hook for 25% of whatever you account for under that program versus 5 or 10% in the case of this particular grant. So it's important to make sure that you account for that as going forward. Now those of you that are just going to make purchases of PPE after the fact, after you receive the award, I think that's a much simpler process, but where you will not, you'll likely be outside of the public assistance incident period at that point, or I'm hoping that we're outside the public assistance incident period by that point, so any purchases at that point wouldn't be applicable to the program. But those of you that are considering reimbursing yourselves for costs incurred as a result of the disaster definitely are going to be cognizant of the fact that you cannot commingle these funds. And the other thing you can't do is you can't use one program to provide match towards another.
Wait, you offered a lecture mode.
The conference is in lecture mode.
All right, we are in lecture mode now. So I think the last bullet there is probably the most important, and that's just coordinating with your local emergency management director, if that's not you, to verify that the PPE that you may be reimbursing yourself for was not accounted for under public assistance. Dave, I think I covered this already, and so most of what I just talked about is all covered under or is part of 2 CFR Part 200, and this is just a disclaimer for you. If anybody happens to ask why you can't do that, then this is the perfect blurb for you to be able to pull out and show the powers that be. Any questions on that before I move on? And I'm going to open it up out of lecture mode real quick. Stand by.
The conference is no longer in lecture mode.
All right. So I'm looking at Kate. I'm reading your question here. So Kate's asking, the PA guidance seems to indicate costs can be covered by another program. Should be submitted there and not to the PA program. Can you verify this? public assistance, FEMA as a rule is always your last resort to pay for something, and we're always the backstop. But in this case, especially with PPE, now one thing to keep in mind is a lot of the PPE that have been coming to the states has been coming from the Strategic National Stockpile, and before April 15th, I believe it was covered at 100% by Health and Human Services. So there won't be a cost share with that. So you're not even going to have to pay for that. But stuff that you've purchased individually as a department, or that was purchased by the state, and then put out, all of that stuff we'll have to account for. If it was put out by the state, then you as a department likely won't be responsible for that. The state will likely cover the match for that stuff. So it's really going to be stuff that you've purchased locally that is going to be the stuff that you're going to have to consider. But to answer your question, Kate, in case this program, the AFG supplemental program, cannot be used to match, or should not be necessarily a replacement for the public assistance program in this case.
Hi, Lance. Can I elaborate on that?
Sure can.
So I think my question is that if a cost is eligible under the FEMA AFG grant, what I've heard is that we're supposed to apply for those costs under the AFG as opposed to submitting them underneath the PA program.
Well, so the problem with the AFG-S program is it's discretionary. So it's still a competitive program. So the public assistance, so I think that it's possible if you had made a purchase of some PPE and had not at the point that you get the award being reimbursed by PA for that stuff, it's possible you could reconcile those two things and cover those costs under AFG supplemental. But there's a lot of stuff that's going to have to be deconflicted at that point. So I'm not telling you that you can't use one versus the other. But what I think what we're trying to really get across here is that you have to be really careful in the situations where you're talking about reimbursing yourself for PPE that you purchased during the incident period, not to commingle those funds.
Right. Okay. Thank you.
Any other questions on public assistance and AFG supplemental?
Lance, Mike Show, Guilford Fire from Connecticut. How are you?
Good. How are you?
And just to follow up that question, our intent initially is to apply under AFG because of the 9-10 reimbursement, and then in the event we don't get the AFGS, then we could go for PA for the 2575. And it seems like this AFGS is going to be awarded quickly enough where we could potentially, it seems like PA is going to be quarterly as this continues to go on. We could potentially look at a second quarter reimbursement if we don't get AFGS. Just try to confirm that's correct.
No, and that's kind of what I guess what I was trying to say to Kate was it's possible that you could take that approach, and as long as you're splitting the two hairs we've got here, and accounting for things correctly. The big thing here is just not getting yourself into trouble down the road. But I certainly think using the PA program as a backup plan and using the AFGS as your primary makes sense to me simply because of the cost share. But again, the key here is for you to be cognizant of this, of the fact that those programs really can't touch each other. As you start reconciling the different costs you've got to cover as a result of the disaster.
A lot of you might remember, if you're in the fire service or in the emergency management, we've used PA in the past after major disaster declarations for snowstorms, hurricanes, and that's where the PA, the public assistance, comes in and help reimburse you for overtime that you might have used to staff up for the snowstorm or the hurricane. In some cases, equipment, supplies, and whatnot. The same applies here. So if you have overtime that you incurred by staffing an additional ambulance in your department, and again, supplies, you could submit them under PA. But again, the advice I've been giving people who've been calling me about this is to look at AFGS first. I think the money will turn around pretty quick. It is a less of a cost share, and if you're not successful with AFGS, you still may have an opportunity to submit for reimbursement under the PA program. So that's kind of where we are. Any other questions on AFGS for 2018, 2019 SAFER, AFG? Any other questions on your mind at all? Can anybody hear me?
David, it's John Otito for Connecticut. One quick question relative to the reimbursement under AFGS. What sort of documentation is the system or the process going to require to demonstrate the fact that we spent those funds and we are actually asking for reimbursement? It wasn't clear in the NOFO.
Usually we'd be looking for invoices. So if you have copies of invoices for the stuff you bought back to January 1st, they may be looking for those to qualify or to certify your request for reimbursement.
Okay. Thank you, sir.
Dave, Mr. Marcarelli.
Yes, Chief.
Question in regards to respiratory protection. So I did read the NOFO, and it talked about HEPA masks and different types of mask types. Many of us switched to air filtering respirators because N95s were clearly not available and still aren't in any large quantity. Do we know if they're acceptable to utilize that? Because it did indicate that certain types of respiratory protection would not qualify.
The way I read the NOFO, and I would ask Lance for his opinion, is that any NIOSH approved respirator is eligible to apply for applying. Lance, do you have any different opinion on that?
No, I agree with that. I mean that in the NOFO, it simply gives the example of N95 or higher level respirator, and N95 is really just the lowest in that class. Right. We'll only go up from there. So, but it really just says NIOSH approved particulate respirator. Period. So, I think that as long as it's NIOSH approved, it's likely eligible.
Okay, very good.
And I'm gonna recommend this grant program. I actually don't think the AFG folks in Washington ever expected that $100 million was going to be thrown at us for this. They put the application together. They put the NOFO together very quickly because there was a huge push to get this money out on the street, which is good. That's good for you. I would encourage you to apply for anything on that list that you need. Don't be shy. I'd even encourage you to look at the decontamination, disinfection aspect of that, especially for those of you who run EMS and do transport ambulances. So be creative on this. And stay within your lane, but be creative on this, and don't hesitate to get that application in. I think it's going to be a quick turnaround. And even though it will go through a scoring process and a review process, just like the AFG grants, I think their intent is to get the money on the street as soon as possible. So hopefully that will work to everybody's benefit. Any other questions out there? Questions?
Just one question, Linda from Westfield. What's the difference between reimbursement and immediate use? I mean, it's immediate use, reimbursement, or future capabilities, so I get that, but what's the difference of immediate use? I don't know.
Okay, reimbursement is if you made a purchase. Back to January 1st, okay?
Yep. Okay.
Immediate use would be something that you need to buy and put into service like today or tomorrow, immediately. And future use would be something to put into your stockpile for potentially for a second wave that might come in the fall.
So there's something that's ordered that is back ordered. So would that be considered immediate use? What would that be considered?
Have you received it yet, Linda?
No, that'd be future, I guess.
I would say if you've ordered it, it's on back order. I would say that would be immediate use because you want it now. It just hasn't arrived.
Okay.
Yeah, I would say immediate use for that.
All right, then that makes sense. Okay. And then somebody asked about documentation, invoice copies. That comes at, like, maybe at an audit? That's not something you submit with your application, is it?
I'm not if you're seeking reimbursement, they may ask you to attach copies of the invoice to the FEMA goal application.
Oh,
if
right.
not, they may ask for that during the review process. So you do need to have those invoices. If you're seeking reimbursement, you will need to have the invoices. The question is whether they'll make you attach it to the application or ask for that during the review process.
Okay.
Good question, Linda. Thank you.
Yep.
Yes, go ahead.
From North Kingstown, Rhode Island.
How are you?
Good, sir. Question for you. Under the terms of reimbursement, we're going to submit, and I'm assuming we're submitting one amount initially for a reimbursement amount. Should we be breaking that down in case there's any aspects that we already purchased that they don't want to cover in a reimbursement, such as some of the disinfecting equipment, purchasing a fogger for disinfecting, or any other pieces? I don't want to lose out entirely if there's one or two components in my reimbursement that they say don't qualify.
That's a great question. I think that you need to categorize the items that you have for reimbursement. If you have 4 items, say gloves, masks, footwear, and disinfecting stuff that you want to seek for reimbursement, you probably have to list them as 4 separate line items, and the budget and the justification would be under the reimbursement category. And then if you're looking for stuff for current or future needs, you'd have to put them in as separate line items. I do not feel that there's going to be, and even though the NOFO says that future use is a lower priority, and even though the NOFO says that disinfection and decontamination supplies are a lower priority, I'm being told that they are a slightly lower priority. And if you put in an application for disinfecting supplies, but also gloves, masks, the disinfecting supplies are not going to knock you, if they're even a little less priority, they're not going to knock you out of the ball game. So I would encourage you to apply for everything. Does that answer the question, Scott?
It does. Thank you, David. I appreciate it.
Okay, it was kind of a long way to get to that answer, but I think we got there. So one other thing I want to mention to you is I mentioned that when you go to fill out your application, we're asking for a lot of the same stuff, that information, I should say, call volume, budget information that you may have already put on your 2019 AFG application when you filled that out back in February and March. Unfortunately, there's no way for you to go into the FEMA Go system and print that 2019 application through FEMA Go. What we suggest you do, if you want to print that application out and use it as a reference when you're filling out this new AFG-S application, is to go into the application, go into FEMA Go, bring up that 2019 application. You should be able to click on View Application. It should come up for you. And then basically copy it and paste it onto a Word document. Not the easiest way to do it, but that's about the only way to do it if, in fact, you want to print out your 2019 application. So, having said that, any other questions, comments? We're here to help, and we'll stay on as long as we have to. Yes, go ahead.
Jim Collins, how are you?
Hey, how are you, Chief?
Good. Question about equipment. A sanitizing fogger. Is that low priority?
Sanitizing fogger, I would request under the supplies category. It's not specifically mentioned in the NOFO, but if I was in your shoes and I ran the ambulance service, I would definitely be putting that in by clicking it under supplies and making that entry. The worst they can do is cut it out. The best they can do is include it. So I think that's one of those items that may or may not be, depending how you look at it, may or may not be eligible. But I would encourage you, if that's one of your needs, is to submit that, and to submit it under supplies and as a piece of equipment.
Thanks, Dave.
Okay, sir. Did you get my message about the SAFER application, Chief?
I did, and I fixed the zip code.
Okay, I'm glad you brought that up because that was an issue that they fixed, so thank you for calling me about that. Any other questions? Any other issues?
Good day, Jay Urban, West Stop and Fire. How are you, sir?
Hey, Jay.
Do you have to disclose on the public assistance grant if you applied for the AFG grant? Is there any disclosure on that?
I don't believe so. Lance, can you help?
I don't suspect that whenever the PA folks come out, they're going to be asking if you're applying for the grant program, unless you volunteer the information. I don't see it as a conflict either way. Our PA folks here in Region 1 are very aware that this grant exists, and we've been putting together some one-pagers for requests for information regarding the conflict between the two programs. So PA is very aware of that. So I think even if you did have a conversation with them to suggest that you applied for some things under PA, they would be understanding of the fact that you may be coming back to them with those costs if for some reason you don't get an AFG-S award.
Awesome. And keep in mind that the public assistance is not an entailed grant application like the AFG is. So it's more of it's a different system than the actual grant application that you'd be doing under AFG or AFG-S. Any other questions, folks?
Steve, Scott McGuire from North Attleboro.
Yes, sir. Good afternoon.
Good afternoon, sir. So a quick question in regards to a regional application in a scenario where you have a nonprofit, non-affiliated EMS agency co-response with a fire department. Is it okay to request for PPE to be shared among the two agencies, or do we have to identify one as the recipient of an award for that community?
Okay, if you're doing a regional application with multiple fire departments, one fire department does have to be the host for that application. That application can include a non-affiliated EMS agency if, in fact, they meet the criteria to meet the eligibility for a non-affiliated EMS agency. So the answer to the question is yes, provided that the fire department is the host for that application, that the EMS agency does meet our criteria for non-affiliated EMS. A EMS agency cannot submit a regional application and include fire departments. So you're going to have a fire department be the host applicant, and then include the EMS agency as a partner in that application. Does that help?
Yes, it does. Thank you.
Okay. Any other questions, folks?
Hey, Dave. This is Lance. Mark Oshry brought up an issue. Mark Oshry's been reviewing applications as part of the peer panel review, and he brought up an issue he's been seeing in a lot of applications that were submitted for the regular AFG program. And in the application, it asked for applicant name. That it's supposed to be the fire department name, not your personal name. And that's one of the things that I think he's been seeing, and one of the things that we actually noticed in the program too, as those were coming in. So good feedback from someone that's actually got eyes on some of the applications that are going in. That is an issue that may be an issue for a reviewer, but definitely that should be your fire department name, not your personal name.
Great, that's a good point. We had picked that up during the application process, that applicant name has been very confusing. It should be the name of your department, not your personal name. Applicant name should be the name of the department that's applying in the grant, in the AFG grant. So great point, Mark, and great point, Lance, bringing that up. Thank you. Any final questions? We're going to be doing this again, the same webinar next Wednesday at 2 p.m. If you want to go through it again, or if you want to spread the word to someone who could have, should have been on it today, it'll be the same webinar. If in the meantime, if you have any problems or questions, give us a call. Keep in mind that the application closes 2 weeks from tomorrow, May 15th. It's a short application period, and as well as SAFER closes next on Friday the 15th as well. So a lot of things are moving. Got a lot of moving parts here. In addition to responding to a major worldwide pandemic. So, but a lot going on. It's going to make for a very busy summer for all of us. Any final questions, comments? Anything else we can help you with? Okay, hearing and seeing none. Thank you for taking the time to join us today. We hope that you continue to be safe out there. Be very careful. And if you need anything from us, just call or shoot us an email. Thank you and stay safe.
Awesome. Thanks, Chief.